the station that's on your side. This is Channel 7 News Daybreak.
Well, a sobering statistic to start this segment. Unfortunately, someone dies from stroke every 4 minutes, and we were reminded of this recently with the death of actor Luke Perry. Baptist Health's Dr. David Gerson with Sherwood Family Medical Center is here to help increase awareness and hopefully save a life in the process. Good morning, Dr. Gerson. Thanks for joining us.
Oh, my pleasure.
Let's start with just something simple, what a stroke is, telling people what exactly a stroke is doing to the body.
Sure, real simple. It's just we're cutting off blood flow to the brain.
Okay.
And there's two major kinds of strokes. There's ischemic stroke, which is the most common, and that's where a clot that can come from your heart, from your carotid arteries, and that just blocks the artery and it blocks the blood flow to the brain. Then there's the one that's a little bit more catastrophic. Well, you just can't tell when it's going to come along, and that's the hemorrhagic stroke, and that's when you have an aneurysm, you have a weakening of the arteries in your brain.
Okay.
That ruptures, and of course you get no blood flow and you get no oxygen to the brain.
It's an immediate.
It's pretty quick. So
there's no way to.
It's the highest fatality, mortality, but and there's really no way to screen for it. It's something that you kind of have that predilection. You have that you're born with. It's congenital. I mean, obviously there are lifestyle things you can do to try to decrease the risk of it rupturing, but very often you just don't know it's there.
Okay.
There's no way to screen for it.
What about symptoms of something like this? What could someone maybe feel, or what could someone watch out for?
Sure. So there's a mnemonic fast that you might see on the billboards.
Yeah.
It's real important, and it's real simple, and anyone can do it. And so we talk about fast. You talk about F, the face. Is there drooping of the face? Is you ask the person to smile. Is their smile just a little crooked, a little off? You talk about A in fast and arms, and so you ask your friend or family member to put their arms up. Is one arm drifting down? Is it weaker than the other? S for fast is speech. Is their speech garbled, or can they not understand your speech, or can they not speak out? They want to say something. And then finally T, time. That's time for 911. Get to the hospital. Now, some people have added some things. The B fast, B is for balance if you see someone walking a little off, or if they complain that their vision is off.
Okay.
But there should also be those other symptoms, not just your vision is a little off.
Is it tough for people who are having one to know that they're having one? Is that why you ask people to, hey, do this, do that?
I think there's also, we're all we don't identify in ourselves that there's something going, this just doesn't seem right.
Yeah.
Maybe it's gas or something like
Sure,
that.
yeah.
But
Indigestion,
if you're with someone, hopefully they can see, whoa, Dad's sitting across the table, and all of a sudden, his face starts looking like it's drooping, or he's not smiling quite right. Or you ask him a question, and it's not that he's not listening to you, he actually just can't speak to you. He's looking at you, can't speak to you. So that's what you want to look for.
Okay, Dr. Gerson, thank you so much for coming in today.
Oh, my pleasure.
Certainly raising awareness. Hopefully that will help someone out there. You can always contact Baptist Health by calling the number on your screen. That's the Baptist Health line. Or for more resources, go to baptist-health.com/stroke.